All right, guys. So let's talk about some questions that I had Chat GPT give me. We're going to do about 100 different questions and what it suggested I should talk on. Um, it's going to be mostly on chronic diseases. So, can people do things with chronic diseases? And we'll go one by one through all these questions here today. So, can people with chronic diseases exercise? Absolutely. And it's one of the things that we tell you to do as a professional. So there's activity and then there's exercise. Depending on the disease, just starting with activity is the most important thing. So meaning like go out for a walk, do things that you enjoy outside, do something that you like to do recreationally, and just start with that. Exercise would be more of a structured thing where now we're really planning everything down to the teeth, right? So absolutely people could exercise. What are the benefits of it? So, the benefits of exercise is that we are now trying to build people up in being able to do something higher functioning, regardless if they have a disease or not. It allows the body to function better with those limitations. So, I'll give you an example. If you already are limited, okay, even if you push yourself a little bit more slightly, the idea is to adapt to that higher intensity, even with the limitations you have now. Thus, when you go back to a lower state of whatever you're doing task wise, shouldn't be as hard as that higher end. So if someone has, let's just put it out there, chronic disease, right? Cardiovascular disease. If I have them walking and making sure that they're okay, and then slowly build up the pace of the walk every day or the distance or the time, eventually at the higher level that they've been adapted to is going to be their endpoint where they feel comfortable enough that the lower speeds or time or activity that requires less energy is going to be less effort. Not only that, your body just gets better at functioning, right? Even under stress or not, it's going to be better at functioning and doing a lot of different things physiologically that's going to help you in the end. What are some common diseases that may impact exercise? So there is a lot. Diabetes is one of the biggest ones, especially type 1 diabetes, that will impact activity and the type of exercise that you do. Because now you really have to pay attention to how you feel. All forms of cardiovascular diseases, coronary arterial diseases, pulmonary diseases, they are also very common, especially like they are lifestyle based, at least a majority of them. Um, they will hinder your exercise. And they're very common. They're in the top four spaces of common diseases out there, like death. Um, some that aren't so common, maybe asthma, exercise induced asthma is something that does come up when you change from environment, but it's mostly heart disease, pulmonary disease, and metabolic disease like diabetes, right? Can you exercise with chronic disease? Yes, you can. You could do it safely as long as you know the signs and symptoms and what you should be looking out for when it comes to adding activity to your life. Got another example, diabetes. You want to make sure that you know your insulin levels before activity or blood glucose, blood sugar levels before activity. When was the last time you took your insulin? What did you eat before that? How did you feel during the activity? Things like that. It's very important to know all these things and keep track of them so you can stay safe. That's the biggest thing when it comes to safety. How can you start? Well, first you got to get cleared by your primary care physician. Big one. You want them to give you clearance that you're able to be active and not worry about, you know, the bad stuff. But it starts there. First, you get cleared, you get some guidance with the care provider, and then you go seek out a professional. The thing is, if you're trying doing things on your own and you don't really know, you might have this sense of fear in the back, or you might not really pay attention to what is the most important thing to the specific disease. So that's how I would recommend you get started. First, see your care provider, your primary physician, and then speak with a specialist in regards to that disease that you have, and then start building out a team. So, all types of exercises are very important for people. But the two main things you want to add is some form of cardiovascular training and then some form of resistance training. Flexibility, yes, it's important, but if you do very good movements in your resistance training, then you won't need to focus too much on the flexibility aspect. But always have some form of resistance training and cardiovascular training. Have a balance of stuff. Now, we could change it up based on the disease. So, for example, in neurological diseases, I usually like to have them work on speed and neural recruitment because it associates with better neurological function and neuromuscular recruitment and improving bradykinesis, things like that. Right? But we could get down the rabbit hole in another question. But again, a balance of resistance and cardio. How much exercise is recommended for people with chronic disease? So ACSM um, always says that you should at least have 150 minutes of some form of moderate cardiovascular intensity in a week. Okay. Accumulative. So it doesn't mean like doing it all in one shot, obviously, but it ends up being about 30 something minutes a day, I believe, or just shy of 30 minutes. Um, and then at least 2 days of some form of resistance training. That is the bare minimum of what is recommended and an average for people that have chronic diseases. Things could be different based on the disease and the severity of the disease. One example would be renal failure. Just having 1 day of some form of resistance training and then some days of at least 10 minutes of activity is good enough to get them started, depending on the stage of the disease. So it really depends on that, but the general guidelines is 150 minutes of cardio, moderate intensity, and at least 2 days of weight training or resistance training. What are some precautions that you need to take? Well, depending on the disease, you need to know the signs and symptoms. I did say it earlier. Like, for example, diabetes. You need to make sure that you know when you took your insulin, what are your blood levels, glucose levels, what time is it, when you're doing, what type of activity you're doing, because each activity is different. The more intense, the more glucose you're going to burn out. Know the signs and symptoms of hypoglycemia and the other risk factors behind it. Same thing goes for every other disease, right? If you have hypertension, severity, or you have some type of cardiovascular disease, you want to take blood pressure before, in between, and after. If you take medications for the blood pressure, you want to know when you took them, how often you're taking them, what is recommended. Every time you keep track, it will keep you closer, being more precaution of what's going on. And then again, paying attention to how you feel from day to day. And then there's a few other things, but that is the average commonality of all these diseases is making sure you know the signs, the symptoms, and being prepared to do activity. Can exercise worsen chronic disease symptoms? Yes, it can. Excessive of anything can make anything worse. Excessive. So I'll give you an example. I had someone today ask me about bone density, and they were leaning towards running a lot. Okay. The thing is, excessive running can actually diminish bone density because the offset of so much impact and cortisol and not enough testosterone. It's a whole blood chemistry thing. But excessive run is shown to have people lose some bone density. Same thing with just focusing on swimming. People that have osteoporosis will end up losing more bone density. So you want to mix again. Inflammation, chronic inflammation with activity, acute exercise will cause inflammation, which can give you a worsened symptom, but then that subsides after a while. So yes, it could be a possibility depending on the disease that you have. It could get worse, but it's typically acute. If it's a chronic thing or if it's constantly flaring, then you have to look in deeper and talk to your doctor about it. Um, can it help you manage symptoms? Absolutely, it can. It can help you manage all these symptoms. You know, it's the adaptation. If I could tolerate a higher level of some form of activity and not feel sick or anything, I'm going to get adapted to that strain so that everything else gets better. And management, some things could be asymptomatic, some things could not, could stay on and could stay symptomatic, but it will diminish with more and more adaptations to what you're doing. So yes, absolutely, it could help manage signs and symptoms of the disease that you have, just from building a tolerance and more efficiency of body use. But again, comes with the disease and what type of disease it is. Yes, you could track your progress. Absolutely. And it could be micro progress. Like something in cardiac rehab, for example. We look at METs by how fast this person walked, the incline they walked, and then how much time did they do on each piece of equipment. And you could track it the same way. You track the time that you did something, the amount of weight or intensity and pace that you did something, and for how long you did something, and then you do that again the next day. And you can continue this cycle. So it's easy to do it. I For other datas, you could always use things like Whoop or watches. It depends on what you like to use to keep you consistent. Um, but mostly with diseases, you want to log in your medications. When did you take them? When did you exercise? How'd you feel? And then the next day, do it again. Those are the biggest things. Because your care physician or main physician, primary care physician, if they had these numbers, they could go and give you better consulting information rather than you sitting there and you tell them and you try and think of everything that you've done. It's easier to have things on a log and give it to whoever your professional is that you're working with. They could see it and you could keep track of what's going on. Can exercise with chronic disease and still see results? Absolutely. You can absolutely see any type of results that you're doing as long as you're staying safe and you're paying attention that you are going in the right direction. But yeah, you could lose weight, you could gain efficiency, meaning you can move faster, you can move better, you could be stronger. Absolutely. How can I find an exercise program that's right for me and my chronic disease? That's a hard one. Only because a lot of times there's a trial and error, but you have to side with the professionals that you're working with. So I mentioned before, you want to start with having a team of professionals that you can lean towards for advice. The program that I usually tell people is that it needs to be a program that addresses the small things but add up to a big component. Let's take COPD. Right, let's take an example of COPD and let's talk about breath. So looking at how someone breathes, just changing the way that they breathe from a chest, barrel chest, which is pretty much the average, or belly chest to diaphragmatic breathing is, let's say, 1%. If I could get this person to start working outside, an environment that they don't get irritated, or in a warmer environment and less of a cooler environment, another 2-3% that I just added. Now, if I could teach them to prepare themselves for activity and be aware of what they should be feeling before that. 4. So things start to stack up. And that's what you want to look into a program that things slowly stack up and you don't get overwhelmed really fast. That's what I would look into a program that you're doing things that you could consistently stay accountable for and that you're not being overwhelmed, right? And then realize that the things that you're feeling is justifiable. Is how can we work around what you're feeling and how can we do things a little differently, accumulative, rather than trying to do everything at once. Uh, yes, you can exercise with taking medication. Just be aware of the side effects of medications. So, beta blockers, good example. With beta blockers, your heart rate's not going to go up, does not go up. So, the way that you monitor for intensity is by going through RPE. So, rate of perceived exertion, how do you feel with the activity? Um, Dilators, vasodilators, things like that, your blood pressure is going to take a dive. So you need to be aware that you're more susceptible to feeling a little dizzy, or you're more susceptible to other components of the medication with the activity that you're doing. Because remember, it exacerbates whatever the medication is trying to do for you. So that's something you need to be aware of when you are taking medications. But yes, you could exercise with it. Just be aware of it. How can I stay motivated? Honestly, just do it day by day, and you do things accumulative. So meaning you don't say like, oh, I didn't do everything I wanted to do today. You say, well, I could do a little more tomorrow, or I could split up my routines. But I know that each day I'm getting better and better. And of course, having someone with you through the journey, or someone to talk to about this stuff, can keep you motivated. Just know that you're doing the right things, and that what you're feeling is justifiable in all means. So, how can you make it more manageable? Accumulate things, right? What are some things that you can do to make things easier for you when you go to activity? You know, um, prime example would be warming up in the morning before you go out. Like actually do some movements before you go. Um, do things that you enjoy. Be excited about going to do activity. Things like that. But always be aware of the pain that, depending on the disease, what will help me subside some of the discomfort that I might have. Can you exercise when you're in pain? My rule of thumb is that on a scale 1 to 10, if you start going past a 4, stop what you're doing and give yourself a break. There's levels of intensity for everything. So I'll give you an example: angina, chest pain. When it comes to activity and you have angina or chest pain, because it's related to a cardiovascular disease, that's not something you want to play with. So the scaling, give me 1 second. Professionals will use scaling, two different types of scaling: the 1 to 10 and then a 1 to 5. I've used the 1 to 5 because it's a bit easier and I can manage people a little bit better. But anytime someone passes a 2 out of 1 out of 5, meaning in chest discomfort, I don't want them to get into a 3. So we stop what we're doing, we wait a bit, we calm down, and then we'll continue this again. Same thing with everything else. So if you have claudication in the calves, meaning like calf pain when you're walking, and it's past a certain level, my rule of thumb is if it hits a 3, like we're stopping, we're chilling out for a little bit, and then we'll continue again. Same thing with everything else. When pain, scale 1 to 10, if it passes a 4, I usually just like stop, let's relax a little bit, and we'll come back to it. Because in the end of the day, it's about accumulating rather than trying to push through it. How can you modify your routine? Again, you could make things less intense, take away some weight. You could take a big break. You could go slower. You could recoup, but in the end, it's about accumulating the stuff. That's how you can modify these things. You get into biomechanics, I would suggest it with a professional. It just makes it easier. But an example of biomechanics would be, my favorite one is shoulder raises, right? Lateral shoulder raises. So from here to here to my hand, it's pretty far, right? Now, if I want to use the same weight, but I want to make this less intense, I could just cut the distance of where my hand is to my shoulder, and that's enough to make the exercise easier without changing the weight. But that's more biomechanical. But again, you take a moment, you take a break, you change it up a little bit, take time doing the reps, accumulate. Can I still participate in sport and physical activity with chronic disease? Yes, you can. Just comes down to how well managed is the disease and how well versed you are. That's the biggest thing. How well educated are you about what's going on with your body? And are you able to manage to pull back the brakes and also go forward with the brakes? My personal best, the people that I enjoy dealing with the most are people that have some form of limitation chronologically and they're trying to get a higher level of performance. I like it because it's a challenging feat, and not a lot of people will take the risk to work with those individuals. I'm up for it. Um, but yes, you just have to be aware of everything and self educated as well. Listen to the team that you have now that's fully built out, dietitian, physician, specialist, exercise coach that is specialized in this, and all of that stuff. How can I talk to my doctor about my exercise routine and chronic disease? Just talk to them. Talk to them. Tell them something. If they tell you that you shouldn't be active, then go get another doctor because it is important. Now, I am a little biased with physicians that are more in line with American College of Sports Medicine because they are the pretty much a gold standard in dealing with diseases, right? And activity. But we're now seeing more and more people getting involved in longevity and understanding that exercise is a component. Some physicians don't push it because it hasn't really been they don't see it as a way to improve someone quickly. Can you exercise if you have some form of chronic respiratory disease? Yeah, you absolutely can. You would want to see where the issue is respiratory wise, get your corrective exercises and therapeutic modalities from the specialist. Um, you always want to check your AVO2 stats, so a little finger thing, right? Or some of these watches now have the AVO2 under it, that shining green light. Um, but again, track everything, your medications, how you're breathing. If you start having shortness of breath, you need to slow down. Biggest thing. Can you exercise with a chronic heart disease? Yeah, absolutely. Absolutely. So, regardless if you have any form of cardiovascular disease, it is the most important thing to be active and build the resilience of your whole system, the whole cardiopulmonary system. And yes, it just comes down to tracking your medications, tracking how you feel, understanding the signs and symptoms. Chronic joint disease. Yes, you could exercise with this one. The only thing with chronic joint disease is that there's so many different types, and the biggest one that most people get is arthritis. So, with arthritis, it's about inflammation, and again, offsetting inflammation. This one, it's a pain in the butt because you could take anti-inflammatories, and yeah, it'll help you, but again, you're exercising to build a tolerance against the inflammation of the joints and just realize that you're going to inflame them. So then it comes back to like, how inflamed is it? Is it to a point that you can't move the next day? Is it the point that you are just way beyond that pain scale that I mentioned, which is beyond a 4 out of 10? Um, Let me slow down. Let me do things that will help me. Uh, Doing a lot of recovery modalities, right? Other types of joint pain, I mean, joint diseases would be like EDS is more of a connective tissue problem, but being too flexible, too mobile, building strength so that you don't lose the ability to keep the joint stable. right? Less likely to subduct. That is the idea behind it, but you can. And those are the biggest things to look for. Neurological diseases. There's a lot of different types of neurological diseases. There are plenty. The biggest things that I tell about neurological diseases is work on power, believe it or not. And the definition of power, which most people think is heavy, heavy weight, let me try and lift off as much heavy weight as I can. No. Power also means speed and velocity. So I could just have someone with some form of disease and just have them work on speed. Some diseases have limitations, as bradykinesis and things like that. We will work on sensory input, work on having them feel things that they're supposed to be feeling, imitating from one extremity to the other, things like that, right? But yes, you could absolutely train with a neurological disease, whether it's MS, stroke, SI problems, a whole bunch of stuff. It's important to still be active. Liver disease. So this one is a tough one, only because you have 4 stages of liver disease, and it just comes down to like, what's your blood pressure look like? What's your metabolic system look like? Are you feeling good one day or not feeling good? Or are you doing things that you have to subside with it? Like it's a tough one, because if you do too much excessive activity, you could actually um, tax the liver. Sorry about that, guys. It's a difficult one in that sense, but yes, you would have to pay attention to all those markers. Kidney disease, a little easier to manage. It's mostly blood pressure, understanding that blood pressure does relate with the kidney disease. And then I'm not going to quote this one 100%, but adrenal glands also get affected with them, in the sense that energy takes a big hike down, right? It's mostly blood pressure with this disease. You'll get put on diuretics, beta blockers, things like that, but excessive blood pressure becomes a problem. Um, so being aware of taking blood pressure before, after, and even in between exercise is important. And as well as higher level of resistance training will shoot up blood pressure acutely. So be aware of that. I usually have people do a lot of single arm, single leg stuff, um, lower weight training, um, more repetitions. But as their blood pressure gets better, and depending on the stage of the renal of their kidney disease, we can change the activity a little bit more each time. Tracking, basically. Skin conditions. I haven't really run across skin conditions a lot. Um, Emphysema, things like that could be agitated by activity. So again, keep track of what agitates, what doesn't agitate. Um, I haven't really gone in too much with conditions. The only one that I could no, because even fibromyalgia is considered a neurological disease. So that one is sensitive to the touch. So we could talk about sensitive to touch, but again, it's a response to how people feel, and you work around that response. Digestive disease. Again, I don't deal with so much digestive disease. I think I've dealt with Crohn's disease. So Crohn's, it's the energy factor with Crohn's, right? And then excessive training again. So getting into the lower ranges and making sure that you understand how someone feels before, after, the next day of activity is important. And making things accumulative is also important when it comes to digestive diseases. Blood disorders. We could also tag in autoimmune disorders. It's about the energy, right? And how people feel. Most of the diseases are usually the same aspect of one another. Um, Too much resistance training can agitate someone the next day. You know. could exacerbate what they're feeling, could feel worse, depending on the blood disease. So it just comes down to managing the side effects and symptoms of stuff. Eye conditions. So yes, you could train with eye disease. Comes down to blood pressure again, biggest thing. Um, if they're diabetic, then we'll also look at blood glucose. But blood pressure, anytime that there is an eye disease, we want to make sure blood pressure doesn't get too high. The other thing is that some diseases, if it impairs vision or it impairs some form of functionality, like tracking functionality, you will see a hindrance in balance. So balance will be a big one to pay attention to eye diseases, right? Sensory input, visual sensory input. Again, depending on the disease. So I've had eye tracking disease disorder clients. The biggest thing is again balance and the ability to do key motor skills, right? So helping them get with the right professional that deals with ocular kinetics, it's very important. But blood pressure is usually a big one that we want to pay attention to. Autoimmune disease, I kind of touched on it a little bit. Yes, you can. It's all about the energy. It comes down to energy. It comes down to the medication that you're taking. Accumulation is better than nothing. So 10 minutes one day, and then 10 minutes a little later in the day, or 10 minutes in the evening, doing a little bit here, a little bit there is the way to go, right? Um, some diseases have flare ups in them, but that's the biggest takeaway when it comes to autoimmune diseases. And remember, you're also exposed to a bunch of stuff too. Endocrine disease. So, yeah, absolutely. I think the worst example I had of someone who had an endocrine problem was someone who had chronic fatigue syndrome. Man, and I feel like a broken record, but it does come with energy. So, completely healthy person, but the problem is the energy level and the amount of force that could be produced by them was very limited. So I'll give you an example. A test that we had to run was two VO2s, one day versus the other. And it's based on a bike test, the wattage test. So we do every minute, we would change the watts from 10 to 20 to 30 to 40 to 50, and you continue until they can no more. This person only got up to 90 watts. So 90 watts is equivalent to um, maybe walking a 4 mile per hour pace. Just give that for a moment. This is a healthy 38-year-old person with chronic fatigue syndrome, like actual diagnosed. And the next day, she was able to sustain it up to 80. So imagine having to go through that. You have to let them get enough rest, give them more of an accumulation of things, and make sure that you're not overwhelming them. Thyroid is pretty much the same thing. Bone disease, osteoporosis. There's levels to osteoporosis, osteopenia, osteoporosis, and then there's higher levels of osteoporosis too. Um, the biggest thing is again, you're monitoring how much activity they're doing. Excessive activity, but you would want to add more resistance training, um, and some very mild forms of impact. And when I mean mild, depending on the severity of the bone density, they could literally just stomp their feet while they're sitting and do that for a while, right? Some form of resistance training, depending again on how severe the issue is. Walking might be enough, um, but it is very important. Swimming is not going to cut it. That's one of the biggest mistakes I see. People trying to do swimming. There's not enough impact and there's not enough resistant force, like gravitational force, tensile force. There's not enough of it. And everything thus far, you need to have that team. Muscle disease. Yes, we could try and prevent atrophy of the muscle disease as best we can. So you need to add some form of resistance training into that person's life. Even if the disease is a degenerative disease, you still need to incorporate it so that you can try and offset it as best you can, or even just build neuromuscular recruitment so that they can still function with lower levels of lean mass. Infectious disease, this one's a tough one because um, day by day how they feel, and if they're sick, if you push them too hard, they're going to get worse. So this one's very delicate in what you're doing day to day. Cancer. So cancer, you need to time it with their therapies. So if someone's doing a therapy, you need to make sure that you time it not too close to the therapy and not too far from the therapy. You need to do it on the days that they feel fine to do things. Um, but yes, it comes down to functionality of the person, being able to be functional, as opposed to just have them laying down all day, then they lose functionality. It also comes down to not stressing them too much, neither. Uh, yes, so mental health exercise has been shown to help stress mitigation, right? But also at the same time, mental health is a bit tough because there's so many different types of mental health. Um, there's also excessive activity that relates to body dysmorphia. Um, and then for other diseases, it helps regulate moods. Um, and again, overall brain function. So again, it's about how they feel that day, and then a lot of times because the professionals there, they won't know it all. That's when you lead to a specialist, a behavioral specialist, right? And you want to work with them hand in hand. Same thing with the physician. So people need to have a team, and those teammates need to talk to each other. If they don't talk to each other, they don't get the full story. Oh, look at that, chronic fatigue syndrome. I just talked about that. So again, it comes down to a day to day, how you feel, how much power can they produce, and just accumulation, right? Uh, how can you manage it during exercise? So we have contraindications, and we have, well, there's contraindications, but there's absolute and then there's relative. Absolute means like you have to stop. Period. I don't care what you're feeling. I don't care at all. You are stopping. So speaking with your pro, you need to be able to justify what is an absolute and relative. Um, and I could go back to the example that I said with angina. So relative would be this person has everything very much cleared. The only thing is that they get mild chest discomfort, and he rates it out of one, right? 1 out of 5. So that is a relative factor. Versus that same person now hits a 3 or 4 on the discomfort scale. That is an absolute. You stop that person from exercising, period. And this is going to be based on the guidelines that the professional gives you. Every professional is different. And also if you're being supervised and not supervised. But other things to manage would be like have snacks with you, have some things just in case if something were to happen. Um, yeah. How can you manage it during exercise? You have to stop, subside, take a hold of what's going on. Um, the medications, you usually don't see them during activity. Um, inhaler could be an example. Carry it on you. Carry everything on you. glucose tabs, everything that you need required, and then learn the steps necessary to actually manage the stuff. Because everybody, again, is uniquely different. Physical limitations, you modify things, you change things up. If you need to cut the session short, cut it. Emotional limitations, there is no wrong, there's no right. Breathe. Take a moment to yourself. Um, you have to understand that when it comes to emotion, it's about being able to be a little better each day, but also realizing that you're doing the best that you can with the limitations that you have, which is not a bad thing. It's just that you are now ready for the next day or maybe later in the day. But every little movement, even if it's just me picking up a pen and bringing it down, improves your health overall. And then emotional, it's tough because we all deal with something different. Um, you talk to a professional about it. You have a social network that's going through the same thing, and you learn to grow from that. Those are my 2 cents on emotional limitations. It's not easy, but you have to do it. Shortness of breath, you take a moment, you stop. Typically, if you could get into a warmer environment, it's going to help you. Diaphragmatic breathing. If you need an inhaler, if you already use an inhaler, use it. But if you have shortness of breath, slow down, stop. If you could recline on a chair, that's better for you. Um, that'd be the best thing to do. And then just breathe out, take deep breaths, 4 seconds in, 4 seconds out. And that's what you would do with shortness of breath. Um, chest pain, again, it comes down to what is absolute and relative. And we're talking about um, scale 1 to 5. I say anything that's past a 2 and a 3, you stop, give yourself a moment, come back, give yourself. If it does it again, and it consistently persists, and it gets close to a 3, just stop for the day. Go back a little later, and try again. But don't play with chest pain. Don't. Dizziness or fainting during an activity. You stop. You stop. You rest. You try and get into a recumbent thing, and then of course you tell someone. Call someone, tell them that you're getting dizzy. You're done. Joint pain. So, um, it's a flare up. So typical with flare ups, again, you stop. You take a moment. If you could get something cold on it, great. Vasoconstrict it, so meaning put some ice on it, and that'll help you out. But essentially, come back to it later on in the day. See if you can do any more. But if you have joint pain, you're done. Muscle cramps during exercise. So muscle cramps could be caused by a lot of different things. Too many things. If it's one cramp, you sit it out. You can massage the tissue, let it try and recoup a little bit. Um, but it could be related to a lot of stuff. It could be just a muscle trying to fire back from not being used. It could be related to a shortened movement. It could be related to a neurological disease, right? It could be a lot of stuff. But just sit it out, wait. You could try and massage it a little bit. I usually get people to apply heat that help them to relax the tissue. Um, and then just give it a moment. If it persists, you're done. Just give yourself a break. Come back to it a little later in the day. If you have nausea, yeah, you're gonna end the day because nausea is typically not a good sign, right? Uh, this one's tough because energy levels will change regardless. But I would say that if you are If you start with an energy level of 8 out of 10, super great and hyped, and then all of a sudden you get down to a 3, stop, tell someone, record it, check everything, blood pressure, glucose, everything, and see what's going on. Because if it's a drastic change, something is not going the right way, and you need to look at what it is. Assistive devices. Yeah, use them. Absolutely. Use everything you can, whatever can modulate your activity. If you need an oxygen tank because that is part of your disease, use it. If you need blood pressure cuffs, use it. If you need a glucometer, use it. If you need an AVO2 monitor, use it. Anything you can that will keep you safe, use it. Yeah, this is a no-brainer. Yes, stay hydrated. For every 2.2 pounds of water that we lose, your performance drops. When you have a disease, it's even worse. You basically just drop like a sack of potatoes in your performance. You will not feel good depending on the disease you have. So yes, stay hydrated. Drink some water. Neurological diseases, there's a few of them that do feel like you could feel like you're not sweating, but you are. And then there's a few diseases that feel like you're overheated, but you aren't. So paying attention to those things is super important. MS is one of those tricky ones. Absolutely, diet will help you with exercise. You're gonna need a dietitian anyways. So diet, and you need a dietitian, not a nutritionist, because I can't personally say it, but I know medications have some adverse effects with certain food groups. The dietitian will be better at explaining it than I do. Like, I'll give you an example. I forgot what. There's a metabolic medication that gets affected by grapes. Don't ask me. I forgot which one it was. I know it. It's been decades I haven't heard this one. But yes, the dietitian will guide you in what you need to eat specifically for you. If you experience a flare up, take a break. Take a break, breathe it out, do what you need to do to recoup, and then come back to it a little later today and in the day, or start the activity the next day. Stay safe. Have a professional with you. That's how you can reduce risk of injury. And then really pay attention to having things around you to safeguard and prevent you from having an injury. For example, balance. You want to make sure you have things around you that you can hold on to for balance. A lot of times I have people using hiking poles, right? And take them with you everywhere for balance problems. Yes, you could do strength training and you could do very high intense, or low intense. The high intensity strength training, I would have you work with a professional on that. Because again, it comes down to blood pressure, AVO2 saturation, blood glucose, and really understanding what you can do with your disease. Absolutely, you could do cardio, walking at a higher pace. You can even do interval training, but again, you need to consult a professional and what type of interval training will work for you. And don't let it be fooled. There's a misconception of interval training. Interval training could mean going from 2 miles per hour to 4 miles per hour. It could mean 1 mile per hour, from 1 mile per hour going to 3 miles per hour. It could be you walking 1 mile per hour, going into an incline of 6%. It is just what is subjectively tougher for the individual and not exactly what is you see in social media. So whatever is low intensity and high intensity, that is subjective for you. And that's how you would do it. If you use other types of data analytics, you could use that too. But just to keep it simple, it is subjective. Flexibility, yes, absolutely. Um, Very important. The only people I don't have them do too much flexibility is when you have hypermobility, right? Do all the weird circus things. Yeah, don't. Balance exercise, yes, you can, which is super important. I have people do it without their shoes. You get better feedback of the floor, foot sensory, everything else when you don't have shoes. Again, it's a feedback loop of sensory with your feet and balance. Yes, absolutely. One of my favorite things to have people do is learn how to do diaphragmatic breathing through the rib cage and not the chest or the stomach, and doing a box breathing method. Um, those with COPD, I teach them how to do the pursed lip technique. So I usually have them do both, right? But yes, absolutely. Mindful meditation, stepping outside, being mindful of the situation where you're at, things like that. Whatever helps you with stress management, fantastic. Do it. Absolutely. Most people like to exercise at home. This one's a given one. Um, Again, just be safe at home. Don't be around anything that's dangerous that you might fall if you have a balance issue. Um, yeah. Yes, you could join a gym. Just realize that gyms are not built to understand what you're going through, depending on the disease. So just be aware of where the AED is in the gym. Um, get to know the people, the staff, and let them know if you can about what's going on, what you have, what you don't have. That way, at least they have some attentive, right? But just be aware gyms are not built necessarily for you in the case, right? Even though they say it's ADA compliant, it's not. Um, so finding support groups, Facebook, to be honest, you on Facebook, find a group that aligns with what you're going on. You'll find a lot of supportive groups. Now it's very open. Um, Specialty doctors, coaches, like that. But typically, the Facebook group is usually the best place to look for when it comes to this type of stuff. Finding an exercise partner through the Facebook group, being able to talk to them, maybe FaceTime them, find someone that's willing to go with you in your times, right? Could be a spouse, could be a friend, could be a family member, if they're open to work out with you. Yes, you can. It just comes back down to being aware of what your diseases are, signs and symptoms, staying safe, having all your medications, keeping track of all the stuff before taking on the sport. Yeah, you could absolutely work with a physical therapist to understand what is safe exercises and routine in chronic diseases, but you need a team because physical therapy will take you X amount. You'll need to have an exercise physiologist that deals with chronic disease. So, a clinical exercise physiologist. If you have a pulmonary problem, you would want to talk to a pulmonary rehab specialist, right? But they all have stages. So, typically, the cardiac and pulmonary rehab are going to be mostly in the acute phase in the hospital, and then you would want to transition into a clinical exercise specialist. The physical therapy will mostly deal with the acute issues and acute balance and know a little bit about mechanics, but the physiology aspect of it, they're not the best people to deal with when going into the physiology of stuff, right? So, really understanding the disease. So, yes, you can still do a lot of things with mobility issues, even with activity and exercise. The emphasis will be doing good movements, and then that will slowly build up your mobility. That's the easiest way to to increase mobility. So, finding accessible exercise equipment. Like I said, most gyms are not truly built for people. Everything should be ADA compliant, but finding places that have the more user friendly equipment would be ideal. So, for example, if you have troubles walking, try and find a gym that has a new step or an upper body ergometer or things that are more compliant if you have things you have to consider in safety, right? Um, you have to Google it and actually call them for it. So, staying positive. It's hard because when you're in pain, you you feel like that's an identity. But remember that every little thing that you're doing is going to add to something greater. 1% plus 1% plus 1% equals 10. Um, we all go through some stuff. And being aware that it's okay, again, to feel the way that you feel, it's not allowing yourself to get into the rut or even just having this support team that's going to help you get out of the rut and be aware that there is a better functioning capacity if you kept on moving forward. It's hard. Like, this is a hard topic. But there is always something better. Just got to give it a little push and think about more of accumulating stuff rather than trying to just like get it done right there, you know? Some common myths are you can't exercise, you will never be self sufficient, you um, will never really get better, you will always have this problem. Um, this one hurts me only because I've worked with people um, that pretty much have gone through professionals, and every one of them has told them, you'll never get better, you'll never feel better, you're just going to pretty much waste. And that is the most painful thing to hear when you have these things going on for you. So the myth is that you'll never be able to get better. That is the myth. Everybody could get better. And I'll give you one story. I had a woman who um, had a snake bite. She lived in Mexico. She got a snake bite, and pretty much she had necrosis of her whole left calf. They had to slice a little more than a third of her calf off, and they told her she couldn't walk. They told her that she can't be fully functional. They told her that she was going to pretty much be sedentary forever and lose all hope and all this stuff. And she went on like that for 10 years, you know. And like, you know what, we're going to do the best we can. There's going to be better movement, there's going to be better functionality, there's going to be better everything. We just have to find ways to go around what you're going through. And the easiest thing was just to teach her to overcompensate for the lack of the tissue that she's missing. So have her focus more on the lateral head of the calf that she still has. Focusing more on plantaris, focusing more on her hip, focusing more on her knee. All these little things accumulate. So a week passes by and this woman is walking by herself. That is the myth that I will tell you that just hurts seeing. And it's not the first person. There's multiple people I've dealt with that go through this stuff. Um, Knowing that there is a solution, but the person needs to be creative and keeping the person safe. I'll leave you with that. Um, Addressing your fear and anxiety. So when it comes to this stuff, um, you need to be, again, be aware that you don't have to do everything at one time, and that Yeah, you're going to go through some discomfort, but the idea is that we don't want to put you through pain. So you have a choice. You could allow the fear and anxiety to take in and you just stay where you are now and don't do anything, or you try and slowly step your toe into that water. You slowly do things that's going to make you feel more comfortable, more confident, and you start building a new resilient body. um, but stress techniques, breathing, meditating, mindfulness, being aware that this is not the end, that there is some form of a silver lining, super important. So addressing your feelings and frustration, it comes down to, again, the mindset. Remember that, yeah, there is going to be some frustration because you are pushing yourself, and there's going to be days that you feel like you go backwards, but there's always a back and down. Success doesn't just go linearly. You're always going to have ups and downs, and being aware of that is important. um, Common challenges, again, the mood, the energy, the pain, the side effects from medications, the drowsiness, the kind of like not being in yourself in retrospect. That is the biggest challenges when it comes to all of that. And then understanding that when you do some exercises, you will have some exacerbation of it, so you might not feel well. But knowing that once you do recoup from it, you're going to be better the next day for it. You just have to do it. You have to do it. If it's one rep at a time, you do it. The next day you do 2 reps. The next time you do 3. The next time you do 4. It's accumulating things, and I cannot keep unsaying that. It's a slow and progress grind that lets you break through these barriers. So realistic goals, I usually say, if you have, we want to make it as attainable as possible. And I'll give you an example. I had one person who said she can't walk 2 blocks without shortness of breath. So, okay, so let's do this. Realistically, let's give you 2 weeks if you're consistent and see if we could attain at least a block and a half. So the goals are always going to be undershot versus overshot, because now you're giving that momentum to feel better. So 2 weeks came by, she was able to do 2 blocks and a half. So now she feels even more enjoyed because she just killed her realistic goal. But small goals to the bigger one is the most important thing. Do it day by day. That's how you can stay consistent. Just don't give up. Do a little here, do a little bit more the next day. You add it all up. It comes back down to, again, being able to resilient a little bit harder activity so that the lower activity doesn't feel so hard anymore. Absolutely, it can. All right. All right, guys. So let's wrap this up. With chronic disease, there's just a lot of stuff that you want to look at. Um, there's so many different variables. it just comes down to being consistent. Listen to your body, track everything that you're doing. Um, have a team. Don't do this by yourself. Have a support group. All these little things is the main thing that's going to help you succeed forward. And I could say, honestly, those are the things that will allow you to propel yourself forward. Um, I've seen a lot of people, and it's the biggest component having all that aligned. Those are the ones that I see most successful. Um, and also the mindset, not putting yourself into that despair and falling into the despair is where I also see people thrive. The ones that are happy, the ones that are grateful for where they're at, even though they have the limitation. Um, those individuals usually do a lot better than those that just seek into their identity of pain and discomfort. So if you have to leave with anything today, that is the biggest takeaway when it comes to all of this. All right, guys. I'll see you for the next one.